Hi class. So today we're going to discuss the National Labor Relations Act. We also call this the NLRA, and we're going to talk about unionization with nurses. In 1935, Congress passed the National Labor Relations Act, also known as the NLRA, making clear that it is the policy of the United States to encourage collective bargaining by protecting workers' full freedom of association. The National Labor Relations Board describes this act as protecting workplace democracy by providing employees at private sector workplaces the right to seek better working conditions and designation of representation without fear of retaliation. This act gives employees the right to self-organization and to form and join in labor organizations, to bargain collectively through representatives of their own choosing. Nurses should think long and hard before making the decision to support unionization. They must do the appropriate research and really understand what it means and what it looks like for them. They need to think about the legal implications and what legal rights and protections that unionization afford to nurses. They need to be aware of the union dues and the fact that they will not get paid in the event of a strike. Is this something they are financially prepared for? They ultimately need to explore the purpose and goals and make sure they line up with what they're looking for. An article from the Nurse Journal discusses the pros and cons of unionization. Some of the pros include ensuring safe working conditions by having certain standards for working conditions like safe staffing ratios and safety from harassment and violence. Another pro is better pay and benefits, including insurance coverage. One pro that the article pointed out that nurses seem to love is the consistent standards for hiring, promotion, and termination, because the employees know exactly what to expect and are all held to the same standard. The article also discusses some of the cons of unionization. The most common con among nurses is the union fees and unpaid strikes. They must be prepared for this to happen at any time and be financially stable to afford to not be paid during a strike. Another big con that nurses point out is the fact that unions are meant to protect nurses rather than patients, which this can negatively impact patient care. One example the article uses is that unions make it difficult to terminate nurses. In turn, this leads to more nurses possibly providing poor care to patients. If a group of nurses seek union representation to resolve their concerns about poor relationships with physicians and their failure to respond to urgent care for patients or unsafe working conditions, there is a lot that can actually be in their favor. One, they are protected by the laws under the NLRA, so the fear of termination should be at ease. They have a larger number to make their point. There's a huge difference between one nurse raising a concern compared to a group raising the same concern. There are, of course, disadvantages to this as well. Even though they are protected under the NLRA, this doesn't stop strained relationships from forming between physicians and management. This can quickly lead to low job satisfaction. This can even happen between the union and other nursing staff. Not all nurses believe in the same decisions, so this leads to workplace issue and strained relationships between bed staff nurses. Communication strategies play a very important role in creating healthy relationships between staff, management, and other leaders from the organization. An article from the NIH discusses some of these strategies and the impact they have on these relationships. Regular check-ins are vital. This allows staff and leaders to express how things are going on their end and what needs modifying. This can lead to establishing trust between the groups. Everyone's opinion is heard. During these meetings, there must be accountability with everyone. Constructive feedback is always important. Nurses can do this without blowing something out of proportion by controlling their tone when they talk about their issues. Job satisfaction is huge, and it's important for nurses to be open with management and tell them what's going on and what needs fixed. Nurses also have to be accountable for following that up with possible solutions. If a nurse is following the guidelines of the NLRA, then no, they should not be concerned about being terminated. The NLRA protects nurses' rights to engage in coordinated activities for the purpose of collective bargaining or mutual aid and protection. With that being said, while following these guidelines, nurses also must act in a professional way when they carry out these actions. Thank you.